Have you ever wondered what roundworms and human helminths are and how they affect humans? Well, roundworms belonging to the phylum Nematoda and human helminths, a broader category of parasitic worms, are both microscopic invaders that can infect humans. These parasites can lead to a range of diseases, from intestinal infections to tissue damage. The impact of these worms on human health is significant, especially in areas with poor sanitation. Stay tuned as we delve more into the world of these microscopic invaders. Roundworms, belonging to the phylum Nematoda, are a type of helminth that can wreak havoc on our health. These cylindrical, unsegmented worms with a smooth outer cuticle are often responsible for a variety of health issues. Key species include Ascaris lumbricoides, an intestinal parasite causing ascariasis, and Enterobius vermicularis, or pinworm, which is especially prevalent in children. Another species, Trichinella spiralis, causes trichinosis, often transmitted through undercooked meat. The life cycle of a roundworm is a fascinating, if somewhat unsettling, process. It begins with eggs being excreted in feces, which then develop into larvae in the environment. Humans find themselves in the unfortunate position of host when these larvae are ingested. Symptoms of roundworm infection can vary from species to species, but common signs include abdominal pain, diarrhea, weight loss, and in severe cases, intestinal obstruction. Transmission is often due to poor sanitation and hygiene practices, with contaminated food, water, or surfaces being common culprits. But there's good news. Treatment for roundworm infections is readily available. Anthelmintic medications such as albendazole or mebendazole are commonly used to combat these parasitic invaders. However, prevention is always the best cure. Maintaining good hygiene practices and ensuring proper sanitation can significantly reduce the risk of roundworm infections. Now, let's broaden our scope to talk about helminths, which encompass a wider variety of parasitic worms. Helminths are a diverse group of organisms that include both flatworms, also known as platyhelminths, and roundworms, also known as nematodes. Flatworms, as their name suggests, have a flattened, ribbon-like body and include species such as tapeworms and flukes. Roundworms, on the other hand, are cylindrical and smooth, with species like Ascaris and pinworms, among others. The impact of these parasites on human health is considerable. Helminth infections can lead to a range of diseases, from intestinal infections to tissue damage, and even lymphatic obstruction caused by filarial worms. These parasitic infections have a global footprint, but they're particularly prevalent in areas with poor sanitation and limited access to clean water. This is largely because the life cycles of these worms often involve their eggs or larvae being excreted in feces and then ingested by another host. Prevention and control of helminth infections hinge on improved sanitation, hygiene education, and regular deworming programs. It's also crucial to avoid consuming undercooked or contaminated food. When it comes to medical treatment, various anti-parasitic drugs are employed, depending on the specific type of worm involved. It is important to remember that these infections are generally preventable through good hygiene practices and proper sanitation. To summarize what we have discussed today, roundworms and human helminths are parasitic worms that infect humans, causing a range of symptoms and diseases. Transmission often occurs due to poor sanitation and the ingestion of contaminated food or water. Effective treatments are available. However, the key to combating these infections lies in prevention. Good hygiene practices, improved sanitation, and avoiding undercooked or contaminated food. If you suspect a parasitic infection, seek medical attention for an accurate diagnosis and appropriate treatment. Remember, prevention is always better than cure.